No, not really. Anything can be bad if you screw up hard enough, but there is nothing inherently wrong with weightlifting for kids. Many official boards of athletics and exercise physiology approve of it as an alternative to youth activity, and weightlifting does increase strength and endurance in youth while reducing body fat. If your child wants to lift weights, it should be fine. Just make sure they know how to do it right. Official stances of approval include the Canadian Society for Exercise Physiology, which tout that resistance training for children and adolescents can be relatively safe and improve overall health. The National Strength and Conditioning Association also is in approval for properly conducted weightlifting as a feasible alternative for youth activity. Weight training, for children, doesn't appear to cause significant muscle growth like it does in adults. In addition to increasing muscular strength, power, and muscular endurance, regular participation in a youth resistance training program has the potential to influence many other health and fitness-related measures. Resistance exercise may favorably alter selected anatomic and psychosocial parameters, reduce injuries in sport and recreational activities, and improve motor skills and sport performance. From a clinical perspective, it has been reported that regular participation in a resistance training program can result in a decrease in body fat, improvements in insulin sensitivity, and enhanced cardiac function among obese children and adolescents. Resistance training can decrease fat mass in children and be a potential way to combat childhood obesity and can have effects in as little as 8 weeks. When constructed properly, they can be very safe as well. With the high incidence of childhood obesity in the Western world, many children cannot do simple push-ups, pull-ups and sit-ups. It has been shown that even body weight exercises are difficult to perform, and the inability to perform an exercise dramatically affects the child's desire to exercise due to negative feedback. The ability to handle one's body mass is vital to optimal athletic performance, and weight training exercises can be used to reduce the loading and improve the base fitness levels of younger athletes so that they can develop the ability to control their body mass in exercises like push-ups and pull-ups. A strength training program can improve both body composition and increase the child activity profile dramatically. Resistance training in children, as with most physical activities, does carry some inherent risk of musculoskeletal injury, yet this risk is no greater than that of many other sports or recreational activities in which children regularly participate. In one prospective study that evaluated the incidence of sports-related injuries in children over a 1-year period, resistance training resulted in 0.7% of 1,576 injuries, whereas football and basketball resulted in 19% and 15%, respectively, of all injuries. When the data were evaluated in terms of 100 participants, football, 28.3% of injuries, and wrestling, 16.4% of injuries, were at the top of the list, but strength training was not included in this final analysis. Paradoxically, it seems that the forces placed on the joints of young athletes during sport participation may be far greater, and more difficult to anticipate, than those generated from resistance training programs. The belief that resistance training is dangerous for children is not consistent with the needs of children and the documented risks associated with this type of training. Children have been injured in the weight room, however, such injuries are more likely to be accidental in children and typically occur in cases in which the levels of supervision and instruction, technical competency, and training loads are inappropriate. This highlights the need for strength and conditioning professionals to heed safety guidelines when working with younger populations. If children and adolescents are taught how to resistance train properly and understand age and sex-related differences and their implications for resistance exercise, resistance training guidelines and procedures, the risk of an epiphyseal plate fracture is minimal. One of the most important aspects of safety for young athletes in the weight room is an understanding of proper lifting techniques. It is also paramount that coaches know how to teach exercise techniques to children. It is imperative that strength and conditioning professionals remember that children are not miniature adults. No matter how big or strong a child is, children are physically less mature and are often experiencing training activities for the very first time. Children should begin resistance training at a level that is commensurate with their maturity level, physical abilities, and individual goals. Adult programs and training philosophies should not be superimposed on younger populations. In such instances, the intensity and volume of training are often too severe, and the recovery between training sessions is inadequate to enable training adaptation to take place. When introducing children to resistance training activities, it is always better to underestimate their physical abilities and gradually increase the volume and intensity of training than to exceed their abilities and risk injury or long-term health.